Okay, Elizabeth, today is February 3rd, 2014. You're here for a 4-day ketamine infusion. You're from Utah. And I'm going to go over your history just a little bit here, okay? Back in October 2013, you had a tetanus shot done in that left shoulder area, correct?
Mm-hmm.
Initially, the pain was very isolated to that area, but subsequently, the pain has spread. And in fact, the way it spread is the really sensitive skin. In fact, you still have some very sensitive skin down here in your feet, okay? And in the meantime, you've been seen at Boston Children's Hospital, and through all of that kind of a workup, they came to the conclusion that you probably got this RSD, okay? And I agree with that diagnosis, okay? Now, are you ready to do some testing here, okay? All right, remember the vertical finger test? Take 2 vertical fingers, put it in your mouth, please. Atta girl. Good. You have any pain when you do that? Okay, good job. Take that right hand, put it behind your head, please. Any pain when you do that? Doesn't increase your pain. Okay, very good. Now do the left side, please. Same thing. Any pain when you do that? Okay, take that right hand out in front of you, open and close it as fast as you can. Atta girl. Good job. Any pain when you do that? Now do the same for the left side, please. Any pain when you do that? Very good. Good job. Now the next thing I want you to do here, Elizabeth, this is the part that requires a little bit more of a challenge for you. I want you to start up here on your leg, okay, and I want you to work your way down. Remember how I showed you? Nice light strokes like that. Close your eyes. And when you get to the area on that leg where it feels like road burn, remember the road burn signal, just stop and point with your finger. Okay, go ahead. Get started. There you go. Go on down. Atta girl. Good job. Let us know when you get to that road burn.
Right here.
You hit it right on the nose, girl. Right on the nose. Okay, very good. And of course, you're going to have the same problem on the other side. Go ahead and do that just for your own satisfaction. Go ahead. Work on down. Atta girl. When you get to that area that feels like road burn, just stop. Right, there you go. Good job. Next thing I want you to do is I want you to rotate that right ankle for me. Atta girl. Wiggle your toes. Hitchhike back to Utah. All right, good job. Good job. You might make it. All right, you have any pain or soreness or anything like that when you did that?
It's sore.
And where did you feel the soreness?
It's just like in my ankle.
In your ankle?
Stiff.
Okay, all right, very good. Now do the same thing on the other side, please. Rotate and then wiggle your toes. Wiggle your toes. Hitchhike back to Utah. There you go. Good job. Okay, very good. And again, the same soreness in your ankle when you do that? Okay, good job. Now the next thing we're going to do here is we want to see what you can do. You cannot weight bear safely. Okay, we know that. But what I want you to do, you see where your mom's sitting? She's going to get out of that chair and she's going to spot you to make sure it's safe. And I want to see what you can do on your own and transferring yourself as much as you can on your own from that chair over to the wheelchair. I'm going to ask you to relax for a while you're there, and then I'm going to ask you to transfer yourself back to the chair, okay? Okay, Mom's there to watch to make sure you don't injure yourself, okay? Do as much as you can on your own. Mom is watching you. Atta girl. Good job. All right, very good. Good job. Good job. Now, okay, let me know when you're ready to go back to the chair, okay? Let me know when you're ready. Take your time. Take your time. Catching your breath, aren't you? It's all right. Don't rush. No rush. That's quite a little jump you did there. Take your time. Atta girl. All right. Your mom's there to be for safety, okay? There you go. Good job, Elizabeth. Good job. Good job. Now, while you're catching your breath there, I'm going to ask your mom to sit down, and she's going to tell us what kind of an impact this has had since October last year. Go ahead, Mom. Tell us about what she was up to back then.
She was an amazing dancer.
Okay.
She also took 3rd place at her regional science fair.
Great.
An amazing student.
Great.
Very active.
Very active. So this has put quite a big dent in her career and her life, right?
Yes.
Yeah.
You know, in fact, she had had injuries from dance before, but nothing has ever stopped this kid.
Right.
Until October 1st, when she had the tetanus booster shot, and life dramatically started to change and turn, and she stopped.
Right.
Life stopped for her.
Right. Elizabeth, did your mom pretty much tell it like it is?
Mm-hmm.
Do you have anything to add to that story?
Not really.
Okay, no, that's fine. That's fine. Now let me ask you a question here, Elizabeth. You know a little bit about what we're going to do, right? About the ketamine. Do you have any issues, concerns that you want to talk about? Any questions you have? Please, please, anything at all, anything.
What hurt me?
In other words, would you feel any pain during it?
Yeah.
The only thing, to be perfectly honest with you, we have to start an IV on you. I'm going to put it in. I'm going to be as gentle as I can, okay? But we do need to get an IV started, okay? All right. Other than that, it's pretty smooth sailing. And you're going to have some good people in the room. Your mom's going to be right by your side, and that's important. Make you feel comfortable, okay? And you might even get a little high on the ketamine, which is not bad. You'll have like you'll be at a party, okay? Yeah, that happens with the young kids we get in here. Older folks, we don't have that that doesn't happen very often. But with kids, I'd rather let you know that you may start giggling and all that kind of stuff.
Okay.
And that's perfectly normal. And Mom, you don't get any, okay? I know what you were thinking. But, you know, we might give you a little something in a doggy bag, okay?
A little something in a doggy bag.
All right? Okay. Now let's see if Mom has any questions, any concerns. Mom, do you have anything?
What can I expect going into this? What should I watch for?
That's all going to be on that little 12-minute video. Did you have a chance
Yes,
to?
we
You
watched
did?
it.
Okay. Yeah, that pretty much tells it all like it is.
Okay.
It's pretty straightforward. We're going to walk you through everything again before we start, you know, in
Okay.
person.
Right.
Okay. Okay. How about you, Grandma? Do you have any questions?
I do. After the infusion,
Yes.
when we have her back in the motel,
Right.
then what are we looking at? What are
Right.
we watching for? What do we expect?
Right. I'll tell you typically what happens, okay? Typically what happens, they like to take a little nap after they do it, even though they may have slept through much of what we do here. They like to take a little nap, 5 minutes to 15 minutes, then they're ready to go out and eat, okay?
Okay.
Some, now everybody's different. Some will want to go out and eat right away, and that's fine, okay? But they'll be pretty much back to square one. When we turn the ketamine off, they bounce back real fast, okay? In fact, for their comfort, sometimes we try to slow that down by giving them some Versed, okay?
Okay.
Because, you know, once you're in, God knows,
And that helps with some of the anxiety.
yeah, oh yeah.
Okay, perfect.
Yeah. But the most important thing that helps with anxiety is your presence in the room. That's
Right.
huge, okay? That's huge, okay?
Okay.
Any other questions, concerns, anybody?
No.
Okay. Mom, anything?
Yeah, it talked about in the video gauging her level of awareness, but then you said that she may just sleep through some of it. Am I supposed to keep her awake during the
No,
infusions 100%?
no. What happens there is this. If I see some issues that would make it probably not a good idea for her to sleep, I'll let you know.
Okay.
I suspect, based on what I know about her history and her athletic prowess and all that kind of stuff, that she probably can sleep without any problems, okay? But I won't know until we actually give her the ketamine. I don't know.
Do you expect her to have some relief during the ketamine infusions?
Okay, here's how that works. I have learned over the years that the best thing to do is for me to wait until the end to make my value judgment on that. Most patients, you'll see a dose response. So each day you'll see an improvement in her pain threshold. Maybe some of this allodynia will start to shrink and all that kind of stuff. But other than that, you know, she's going to come back on Monday. We're going to repeat all these measurements on her. And that's what's really going to tell the story.
Okay.
Any questions?
No.
Okay. Okay, close your eyes, no cheating.
Turn this off.
Yeah, turn off the sound if you can, so she can
Try.
concentrate.
Turn off the sound. I don't know how.
You got it?
Microphone.
Okay, Elizabeth, you ready? Okay, all right, here goes. Okay, all right. So now, just while she's in that thing, because this doesn't record, just concentrate on what I did here. Okay, there you go. Okay, you got it? All right. Okay, Elizabeth, I want you to look over here at Grandma. Grandma has some questions for you.
Grandma.
Here's
Where's
Grandma. Here's Grandma over here.
Hi, Elizabeth.
She has some
Okay.
questions. She has some
It's
questions
okay.
for you. Go
It's
ahead,
okay.
Grandma.
Elizabeth, what state do you live in?
Utah.
And I'd also like to know what city do you live in?
Riverton.
Very good. Now Karen's going to be over here. Can you see Karen over there? Look over there. See Karen?
Hi, Elizabeth. Hi.
Karen's got a question for you. Okay? Go ahead.
Okay, I noticed that Dr. Kirkpatrick has purple teeth today. Can you tell me what I noticed about Dr. Kirkpatrick? What did I notice about Dr. Kirkpatrick?
Go ahead and ask her another question.
Okay. I noticed that your grandmother is wearing a pink tutu. What did I notice about your grandmother? Do you remember what I noticed about your grandmother?
Elizabeth,
It's okay.
Elizabeth, can you answer Karen's question? She asked you a question. Do you remember the question? One more and that's it. Ask her one more question.
Okay. I noticed that there's a green lizard outside. Can you tell me what I noticed was outside?
Green lizard.
A green lizard? Yeah, you got that one right. That's right. Okay. Now listen, here. I wanted to see if you can cooperate with me a little bit here. Elizabeth, you see my finger up here? Look up there. Atta girl. Good job, Elizabeth. Over here. Look over here. Atta girl. Good job, Elizabeth. Now I got one more question for you. Are you ready for this? Are you ready? Are you ready? Okay, that's a yes. Show me the sign, Elizabeth. Let me see the sign. Get that blanket out of the way. There's one. Where's the other one? Where's the other sign?
Show him the sign.
Show me.
Show him the sign.
Show me the sign.
Show him the sign.
Can you show me the sign? All right, that's close enough. You're doing a good job, Elizabeth. Okay.
Stop.
Okay, that's 2.4. I'll give you a little rest here. You ready? 2.2, and give me a little rest.
Stop.
And 2.0. Okay, good. Now we're going to do your heel and we'll be done. And that's 2.5. Are you ready?
Stop.
2.5. Are you ready?
Stop.
And that's a 2.7. Okay. Okay, so today is February 11, 2014, and your last ketamine infusion was on a Saturday. And so now we're about 2 to 3 days beyond that point. Let's talk about how things went during the infusion itself, okay? During the infusion, we tried to get you higher than 90 milligrams an hour. We couldn't do that. It just seemed like you were getting a little too agitated, that sort of thing. So we got you up, but you're 11 years old, so I was very happy with the dose we gave you. Because when you look at the video we did when you were given ketamine, you were pretty knocked out, right? And that's good. So it tells you that in order for ketamine to do you any good, you have to really shut the brain down, okay? Now, we remember before we started, give me your foot here. Before we started with you, I could just barely touch you like this, barely touch you like that, and you go through the roof. Remember that? Now we can do this. You don't have the sensitivity. We take your foot up like this. We can touch you, right, like this. Doesn't drive you crazy, does it? So, so we know that this has had a big impact, and it's even hanging in there now. It's 2 to 3 days later, and I expect it to continue to do so. Let's go through these exercises. Make sure Dr. Kirkpatrick didn't create any new problems. You ready? 2 vertical fingers in your mouth. You have any pain when you do that? You didn't have any when you started. You don't have any now. Take that right hand, put it behind your head. Right hand, right.
Other right.
All right, there you go. Any pain when you do that? All right, now the left side. Any pain? All right, now take your right hand out in front of you, open and close as fast as you can. Any pain when you do that? Do the left. There you go. So we didn't create any new problems there, did we? Okay. Now the next thing we're going to do here is I want you to take that right ankle. I want you to rotate it for me. Okay. There you go. And wiggle your toes. And all right, on both sides. Now, do you have any kind of pain sensation at all in your ankles? Remember, you had a lot of pain in your ankles when you did that last time.
It's just sore.
You're right. And we talked about that, didn't we? We talked about the fact that you haven't been using your ankles and your knees, and that they get frozen and they get painful. It's not RSD pain. That's pain that's due to lack of activity. Do you understand that? But that with the exercise we're going to talk about here in a little bit, that'll go away. But right now you don't have the RSD pain, so show everybody how you can go down there and touch your foot without feeling all that sensitive skin. Yeah, you can rub your feet together, can't you? Right? Very good. Excellent. Excellent. Now the next thing you remember, when we asked you to transfer from the chair to the wheelchair and back and forth, you had a problem with that. And you couldn't even let your feet touch anything. You remember that? Let's see what you can do now. See if you're more independent, okay, in terms of transferring. Wait a minute. Let Mom get up there. Mom's there to help if you need her, okay? Yeah, go ahead. And hold on to the chairs. Go ahead. Atta girl.
Okay, Carol.
Atta girl. There you go. Take your time. Use your arms. Atta girl. That's it. See, now you're putting your feet on the ground, aren't you? And you know what, Elizabeth? That ground is cold, isn't it? And that's not very nice, is it? Right? Okay, now we're going to ask you to do one more thing. Go back over to your chair so we get a good recording of that. There you go. Atta girl. Good job. Good job. Okay.
Did you turn it off?
No, it was off. It was on standby when I looked into it, so I turned it on. Okay. So, all right. So now let's talk about the treatment plan here, okay? Now, there's one way to improve from where you are right now. So you can get up, walk on your toes, walk on your heels. And that's called heated pull exercises. We talked a little bit about that before. But let's go over that again. I gave you 4 reasons why that works, right? Reason number 1, you're not ready for full weight bearing, okay? And if you try to do that, there's a chance you're going to re-injure yourself very bad, okay? It's going to take a good 4-6 months to get you built back up again, okay? So, buoyancy, that's reason number 1. Number 2, the water is a potent desensitizer to your skin, so that sensitivity you have down here doesn't come back, okay?
Okay.
Just making contact. 3, we said the water is an exercise you can do that you're least likely to re-injure yourself, okay? So, so that's important because re-injury is the most common reason why patients have to come back and get treated again, okay?
Did you hear that?
And we talked about if you have to be treated again, you have to be treated with another 4 days. It doesn't do much good to just do short little treatments with the ketamine. So, now, we gave you another reason why the heated pull exercises work, and that has to do with stress, right? Now let me ask Grandma over here. Grandma, stress, good or bad?
A certain amount of stress is good. Too much stress is bad.
You forgot the N word. Neutral.
Oh, okay. It's neutral.
It's not good, it's not bad, it's neutral.
Okay.
It's how you respond to it. And there's many ways to relieve stress. You know, biofeedback, progressive muscle relaxation, hypnosis, etc. But those don't work for everybody. But there's one thing that works for everybody, right? Grandma, what's that called?
Exercise.
That's right, physical activity. So that's the 4th reason why the heated pull exercises works, because it's physical activity, okay? It keeps the stress under control. Now we said there's another benefit to the heated pull exercises, right? We said that it can help you determine if you're getting better or getting worse. We talked about exercise tolerance, didn't we? Right? Okay. And so when you get in the water, let's say the first week it's 5 minutes, the next week it's 8 minutes, you're improving on your exercise tolerance, right? And therefore you don't need any treatment. You're doing the right thing. You're going to get better on your own. You don't need doctors or anything like that, right? Now, let's say you get in the water, okay, and you work out, I mean, you're doing laps, okay, and you get out of the water after 15 minutes, okay, and you have no pain, okay? Good or bad?
It's bad
Why is it bad?
because I should work myself to the point where I'm just kind of sore.
Absolutely, Elizabeth. You got it absolutely correct. We call that a good hangover, okay? If you get in the water and you end up laying up in bed for 1, 2, or 3 days, that's called a bad hangover, okay? All athletes know, and you're an athlete, you know, you're a gymnast, and you know that if you don't really work out enough, you're not going to make progress, right? And you got to get those good hangovers in there, all right? Now, okay, we talked also about the idea that, you know, from time to time you're not living in a bubble, right? You know what they say, SH stands for stuff happens, right? Okay. Why are you laughing?
Because I usually say something else.
You say something else. Your mom's turning red. Look at her. Okay. All right. So you know, the point is that, you know, whether it's surgery that you're injured by, or whether you have an accident or whatever, you need to treat your pain. That's called acute pain. That's not RSD pain, because if you don't, it can set off the RSD. And you have to get into strong pain medicines like narcotics. That's okay. You know, you go to the dentist, he's got to give you some pain medicine to take when you leave, so you're not sitting there writhing in pain. You need to have the pain control. Whereas other people can afford to bite the bullet. You can't. Okay? All right. Now, we're trying to make this into an education for everybody, for young girls, boys like you, right? So we want to cover some things that are unique to people like you. And I've asked your mom to comment because it was a little bit of a challenge, right, Mom? How we did this. So why don't you comment from your standpoint what the challenges was with her in terms of, you know, at first she didn't want to complete it, did she? She didn't want to complete.
She was adamant about not completing it. It was a scary experience for her.
Yeah, right. So how did we manage that? You want to give us an idea how we made it work?
The most important thing was face-to-face contact, touch, and my voice.
Right.
Key right there, right up in front of her, and reassuring her constantly that it's okay, over and over again.
Okay. That's right. So having somebody else in the room, especially when there's children involved, especially when children who they know and they trust, is key. There's no way you can give a good ketamine, we call it sub-anesthetic ketamine treatment, without having that there. It wouldn't
have been possible with
No,
her.
it would be impossible. That's right. So that's point number one. Another thing we know that's different with kids as compared to adults is that they tend to salivate a lot with the ketamine, right? And if you don't take care of that, it feels like they're being gagged.
Right.
So we had to give her a medication, we call it Robenol or glycopyrrolate, to keep her mouth from getting too much saliva, okay? Right. So that's one of the things we had to do, so that she's comfortable during the infusion. Now, was there anything else that you wanted to bring up about what were the challenges that you had to confront with her in terms of getting through
Keeping
this?
her calm.
Yeah.
And not hysterical through it.
Yeah,
Oh
right.
yeah, we had to control that with some medication.
That's right.
And it really seemed to help, especially by the third and fourth infusion.
Right.
We seemed to have it
Right.
down.
Now that's absolutely correct. Now with children sometimes, but not always, you have to give this medication we call midazolam or Versed. Kids call it joy juice. Now when you do that, it cuts back on the amount of ketamine you can give, but the point is, if she's not comfortable, if you don't have creature comfort taken care of, it's impossible to get the dose up. And we got her up to 90 milligrams an hour, which is an adequate dose, as we know, to treat her problem. Okay?
Right.
So that's really important. So you may find yourself, as a physician, having to give more Versed in a kid than an adult. Not always, but sometimes. In her case, she needed it. She had to have it. Okay? Let's turn over here to Grandma. Grandma, do you have any comments anything you've learned from this experience that you want to share with us?
Wow. I've learned how amazing ketamine is, which has been phenomenal. The improvement is just unbelievable. Also, the absolute patience that my daughter had to have with her daughter. I don't think we would have gotten even through the first day if Yvelle had not been right there and so patient and calm with her. And at times she had to be firm with her,
Right.
which was hard. Other times very reassuring. It was quite a delicate balance, a ballet almost,
Right.
of balancing that out. And every day I didn't know if we would make it through the day, and we
Right.
would get to the end. It was amazing. So
Right. And you're right. There were times when Mom had to really get pretty aggressive about it, didn't she?
yeah, she
'Cause she knew-
absolutely had to.
Well-
because it wouldn't have lasted. It wouldn't have worked if
Right,
she had.
right.
We had to give her that chance.
Right. She needed the full 4 days to do
She
it.
had to have her best chance. There was
Yeah,
no
right.
ifs, ands, or buts about it. It had
Right.
to be.
Well, you came all the way from
completed.
Utah. That's not next door. from Florida. We also talked about the idea that Utah is not the favorite place for RSD patients because generally they don't tolerate the cold very well.
Right.
So, but it's a doable. You can work that. It's just more of a challenge in the cold climates to treat these patients. Let's turn here to Elizabeth. Elizabeth, what do you think of this? Was it worth it?
Yeah.
Yeah. Right. 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 So, is there anything you didn't like about it? What was it? If you had to tell other kids, in all fairness, what was it you didn't like about it?
It made me feel really weird. I was seeing double vision.
Right. Right. And how did we fix that for you? Do you remember?
Eye patch.
Eye patch. That's right. We put one eye patch, made you a pirate. I guess. Yeah. One with an eye patch. That's right. And so you wouldn't have double vision. Okay. Besides that, was there anything else that made you feel weird? Right.
Yeah. And my whole body was kind of numb.
It was all kind of numb. Right. Made you
Yeah.
just feel different. Right.
Like I could still kind of feel stuff, but I couldn't. It was kind of tingly.
Right, right. But you're not having that now, or are you having those feelings? No. Right. Okay. Very good. All right. All right. Good. I just want to make sure we cover everything. The good, the bad, and the ugly. Okay. What about you, Mom? Did you find anything particularly distressing besides the challenge of managing her? Anything else that concerned you?
No concerns. In fact, midway through the second infusion, I was comforted when she told me that the burning pain was all gone.
Yeah.
As
Right.
she was trying to pull out her IV, I'm done. She
Yeah,
says
right.
no.
Right.
It was emotional. It was hard.
Yeah.
But it was a very positive experience, especially compared to the last 4 months and 4 days that
Yeah.
this took a toll on her life.
Right. Right.
stopped.
Exactly.
Well, and I think it's interesting to note that the CRSP, the RSD, actually changed her ability to work with us. She didn't used to be combative and refusing to do things like a 2-year-old like that.
She
And-
became very 2-year-old-like
Yeah.
behavior. You couldn't reason with her. You couldn't talk to her. And that started the minute the RSD started.
Yeah.
It was like I couldn't reach her. It was why I think a lot of doctors thought that this was psychological based and not anything
Right.
else.
Right.
Because it really triggered an emotional component in her along with everything else where you couldn't reason with her to even do the infusion.
Yeah, that's a very good point. You're making a very good point, and that is, it's not their fault. It's just that they can become so overwhelmed from the stress of the pain, they can't think straight.
That's right.
They just can't.
School stops everything.
And let me tell you another thing that can happen, and this is really, really important. It didn't happen to her, but I'm telling you, I've seen it more than once. Many times I've seen it in kids. Not so much in adults, but in kids. And what happens is the stress from the pain becomes so severe that there is a protective mechanism that sets in. We call that a conversion reaction. And what that is their legs can become paralyzed. They can't move. They may even lose their ability to feel things in their legs. And sometimes the parents will take advantage of that, clip their nails, clean their skin or something. So again, that's another thing that if doctors don't understand those problems that happen, that are part of being a human being, a child, they don't understand that thing. Again, they can accuse the child of having more of an emotional problem than a real organic problem. Sometimes they can go blind. They can't see. But you can take them to ophthalmologists, there's nothing wrong with their eyes. Okay? All right, so all of these things are called conversion reactions. So I've seen that a lot in kids. So these kids, they need to be seen by specialists that know some of these things that can happen. Okay?
Okay.
And because they can be very terrifying. So yeah, the stress makes it extremely difficult to communicate with them when they're in such pain. You notice now how more communicative she is.
Yeah.
She's paying
sassy.
attention. She's learning. she's asking questions.
She's reading again for the
Yeah.
first time in over 4 months.
Right. Exactly. Okay. Unless anybody else has any questions or anything, I think we're just about done.
Yeah, I
Yeah.
have
Let's get your
one.
question. Yeah. Go ahead.
Wait, so I've in talking with other people that have had the RSD and they've been in remission a few years later. For some, it comes back. From what I've been told and what I've noticed, it seems to be trauma, surgeries, injuries, and the cold.
Yes.
even bringing it back
Right.
even a few years later.
Yes. Yeah, that's true. Those are triggers. The most common trigger is re-injury. Another one that you didn't mention is important because they get themselves caught up in a big stress ball
Right.
and they can become overwhelmed. It could be maybe a divorce in the family, something like that. Something very serious happens and that can set it off, okay?
Okay.
So all of those are potential triggers that can happen. And we also talked about once you have RSD, you're prone to get it again from re-injury, okay? So they have to be careful. I
Because
suspect
she's already
after
been programmed that way.
yeah, she's programmed. So I think after 4 or 6 months of conditioning, however, she can probably afford to take risks and not worry so much about it. It's also important to note you have a very well, clear, documented video right now where we started with her. And so she's not living in a bubble. She's going to have setbacks like any kid.
Right.
And when that happens, she can go back and say, well, look, I couldn't even transfer myself to put my feet on the ground before, but now I can still do that. So she doesn't get all caught up in this negative
Where
catastrophizing.
it feeds it and makes it worse.
Right, yeah, catastrophizing about it just is not good. So what I'm suggesting is that maybe once every 2 or 3 months, just walk her through these exercises. So
Okay.
she can prove to herself she's not going back to where she was before.
Right. Well, and she was on a very, we talked about this, on a very high competitive dance team where she would injure herself every couple months and she'd get back up and she'd dance again. So do you think that, with injuries taking place every couple months, do you think dancing is something she's ever going to be able to do again?
No, I think dancing is fine. There's different types of dancing which are safer than others, okay?
So just not the high competitive stuff that
the
she
stuff
loves.
where there's a lot of risk of trauma,
Right.
blows and trauma, a lot of shocking to the knees and the ankles and stuff like that.
So no more competitive dancing.
Yeah.
Just more mild.
Not for the time being. And that can be very creative and requires a similar kind of skills, except you're just not exposing yourself to all those high risk maneuvers. Okay.
And then dental care. I've heard of people going to the dentist and the RSD coming back from getting dental work.
Yeah, we talked about that.
Yeah.
The dentist has to, first of all, numb you down real good. There's no reason why they can't, even for a root canal, they can numb you down and you don't feel anything.
Right.
You got to tell them you cannot afford to have her in pain. And give her plenty of pain medicine, even if it requires opioids or narcotics, after the surgery.
What do you recommend? Because the dentist will write you prescription for pain medication, but then for RSD, for being in remission with the RSD, what do you, the same dose that a regular dentist or doctor would give, or do you recommend increasing it a little bit, or?
No, you just go according to, you what we call it titrating. In other words, you give one pill and then you see how that responds and so forth.
Okay.
You're dosing her upwards.
So we can't afford to have her in pain at all because it could reach
Well, a
the
little just, I
RSD.
already said that, we expect her to have some pain after working out.
Right. But not to the level of...
Where it's incapacitating. Now,
Okay.
that you can't afford.
And then is there any vitamins or herbs or anything that you recommend that she takes? I saw a study actually where they noticed that vitamin C helps with
she's going to get
this.
most of what she needs just through a
Okay.
regular diet, as long as she's not doing stupid things, eating all this fast food stuff.
And if we have any signs of the RSD coming back, we have to come back and do another 4-day ketamine infusion.
Probably, but let's see how let's
Okay.
don't make that decision until I see what's going on.
Okay.
Okay?
Okay.
Now, you did a good job, right? She did a good job, right?
Yes.
So let's...
You too. You were incredible with her.
Yeah,
You
yeah.
gave her that grandpa
Yeah.
male figure talking to, and she needed it.
Did I kick your butt?
We appreciated it.
No problem, no problem. So today is April 8th, 2014, and it's now approximately 2 months since your ketamine infusion, your 4-day ketamine infusion, okay? And before we go any further, we got to make sure we know where everybody that's here. Okay, here's Mom, and here's you, the patient. And here we have, what is your name now?
Bella.
Ella?
Bella.
Oh, Bella. I'm sorry, Bella. And how old are you?
9.
And you're the sister, right? And here's another one down here. What's your name?
Alea.
Elena? Okay, and how old are you?
Leia.
What?
Alea.
Alea. All right, Alea. So how old are you?
4.
4 years old? All right, very good. So we got everybody introduced here. All right, let's go over your history just a little bit, Elizabeth. All right, so back in October of 2013, you had a flu shot into that left shoulder area, right? It was a tetanus booster, right?
Yeah.
And you ended up getting real sensitive skin there. As a matter of fact, your whole body became sensitive to light touch, right? And then it seemed to settle down into your legs, right? Down into your feet. And in fact, you couldn't even walk, okay? You were unable to walk, which is terrible to be 11 years old and can't walk. And so, so you came here, we made the diagnosis of you have this complex regional pain syndrome. And so we decided to go ahead with this 4-hour a day for 4 consecutive days of the ketamine. And we're talking now about the ketamine being given as conscious sedation. In other words, not to put her in a coma, but it's what we call sub-anesthetic ketamine, okay, 4 days. Okay, we did your pain thresholds, and your pain thresholds demonstrated a profound improvement in your pain. Okay, that was an objective measurement. And also at that time, you could walk for the first time where you couldn't walk before. And we're going to show a little video clip here where in fact, the only way you could transfer yourself from that chair to that chair is to crawl from one to the other. Am I correct on that?
Yeah.
All right. Okay, very good. Now, so let's go ahead and run you through the usual exercise program here. So go ahead and put 2 vertical fingers in your mouth. See if you have any pain. Any pain when you do that? Okay. No pain when you started either. Okay, go ahead and put that right hand behind your head. Any pain when you do that? No. Now do the left side. No pain when you do that, right? Okay, you didn't have any when you started. Now, you did have some issues here with regards to the sensitivity just above your ankles on both sides, right? So what I want you to do is take off those sandals now and close your eyes so you don't cheat, and go ahead and rub your hands down there and see if you have any more of that sensitivity down there. There's a black line down there where you had it before, where it felt like road burn, right? You don't feel that anymore, right? Now do it on the other side. Do the same thing. Okay, there you go. No sensitivity. All right, now go ahead and rotate your ankle on the right side, please. You had a lot of pain when you did that last time. What's the pain like now? Do you have any? Okay,
It's
now
just a little bit sore.
just a little bit sore. We talked about that, didn't we? Because even 2 months down the road, even though you've been very good about doing your water exercises at least 3 times a week and sometimes more than that, you still have some residual pain. We talked about that being due to just being out of shape. When
Right.
you're not walking, joints get stiff and they take a while to regain. When you agree with me, the kind of pain you feel down there, if you feel it, it doesn't feel like the RSD pain, does it? Okay, right. Okay, now what I want you to do is I want you to take the other foot, rotate that for me. Yeah, there you go. Very good job. Excellent, excellent. Good job. Now, the next thing we want you to do is once you get up there in front of the door, we know you can walk safely now, but you couldn't even walk before, okay? So we're just going to ask you to take 3 steps forward, please. Atta girl, 3 steps back. Atta girl, 1, 2, 3. Did you have any pain when you did that? Okay.
It's just a little bit sore.
Just a little bit sore. Okay, and we talked about that, right? How to get rid of that. Next thing I want you to do here, Elizabeth, I want you to take 3 steps forward on your toes. Atta girl. What are you going to go become a ballerina now? Is that what you're going to do? Or are you just trying to show off? Huh? Did that increase your pain by walking on your toes?
No, just sore.
Just sore. Okay. Now do your heels, please. That takes more balance. Atta girl. Good job. Now going back on your heels. Again, did that increase your pain?
Just sore.
Just sore. Okay, very good. Now the last thing I want you to do now, this is the big test. Okay, you ready for this? This really proves whether or not you did any good. Now do you see that black stretcher over there? Okay?
Yeah.
You see it? Okay, here's what I want you to do. I want you to leap from where you are there onto that stretcher. Can you do that? Can you?
Yeah. I'm not
Yeah, you're gonna fly. No, you can't do it? All right. All right. Sit down. I guess we didn't create a real miracle here, did we? All right. Now listen, let's talk about a few things that happened during the infusion. For one thing, there was 1 point or 2 points or occasions in which you really wanted to almost give up on it, right? Because you felt uncomfortable, right? Now, when you look back on it, describe for us the difference between what would you rather have, the CRS pain or go through another ketamine infusion. Compare the two for us.
Well, I'd rather go through another ketamine infusion. It's a lot better than having CRPS.
Right. Now, I want you to also talk about what it was like for you, the fact that your mother was by your bedside during that whole time. Could you think you could go through a ketamine infusion without your mother being there?
No.
Wouldn't happen, would
There
it?
was no way.
It really kept you grounded and feeling safe, didn't it?
Yeah.
Yeah.
How close did I have to be to you?
She had to like literally be right in my face.
Writing, that's right.
Touch.
Yeah.
Face touch.
Yeah, a lot of
voice in the
touching. Yeah,
ear.
right. Physical contact. Because remember now, when you get the ketamine, you know how you lose your mind temporarily, right?
Yeah.
And that can be very scary, can it?
Yeah.
Yeah, right.
Kind of feels like
So-
you're down in a black hole.
Down in a black hole. That's right. That's
Yeah.
right. So that again, we're using this for educational purposes. It's important for people to understand. That's very critical in terms of making the ketamine work. Is you have to be comfortable. Okay, that's really important. Now, the other thing we want to talk about is that when you had the CRPS starting in October of last year, you were very sensitive to sounds. You remember that? Has that improved?
A little bit. I still am pretty sensitive to
Yeah,
it, though.
but not as much. Okay,
Yeah.
very good, very good. Now, Mom, I know you've had some questions, so why don't we cover some of the things that you've noticed, some differences that are important to point out.
One of the biggest things that I'd say I've noticed is when I look at her, I see my daughter again. She's happy, she's bubbly, but the swelling in her face, and I'd say the swelling in her entire body has gone down, but you notice it more in her face. She's got her cute little thin face instead of it being puffy, and she sparkles again. Look at those beautiful eyes and how they sparkle.
Yeah, and she likes to kick my, you know what? She's getting sassy, you know,
She
right?
is. She's very sassy. That's my little girl.
Yeah, yeah,
She's
yeah.
back.
Don't you stick your tongue at me again. Yeah, that's true. And as a matter of fact, if you look at the photographs that we took, and we'll put those up so people can see it, you'll see there's clearly a decrease in this puffiness in her face after we treated her with ketamine, and she's continued to lose that puffiness in her face. Okay, and so a lot of these things that her kind of I can't think of a better word to describe, kind of a cocky attitude that she had before. That's fair, right? Isn't it? Sort of.
A little bit.
That we can understand when children are afflicted with something like this, it can really make them very irritable, extremely
Yes.
irritable. Do you agree with me?
Yes.
Do you find the irritability is improved on her?
Oh, yeah.
Less of a short fuse.
The irritability has definitely improved. She's got her attitude back.
Yeah.
What does that word
Like
mean?
I said, she's back.
Yeah. She is. I know I had a difficult time, communicating with her before all this happened. We all did.
Nobody could talk to her. She
Yeah.
didn't want to talk. She was so focused on trying to focus on whatever she needed to
Right.
try to beat the pain. Don't ask me a question. Don't ask me how I feel. Don't touch me. Don't come near me. Don't even breathe next to my foot, especially.
Right. That's
There's
true.
even, like,
It would you
fan.
would accidentally like bump the bottom of her foot, like
Yep.
one of her sisters, and she would immediately her pain levels would go up so high to where it would throw her into these like convulsions. She'd get
Right.
scary. She would stop breathing.
Right.
Um,
Right.
And
Right.
and now you can. I mean, look at this. Let me see your foot. Let me see your foot. Look what I can do to it now. I can just. I mean, this.
Yeah, have fun with it. Now,
Yeah.
what about some other issues that you were concerned about that we want to deal with?
She has asthma. It's seasonal. One of my concerns is something like an asthma attack, or like when the inversion hits in Utah.
Yeah.
This big bubble.
That's
so
right.
It's all this dirty smog down below.
Yeah.
Creating, and her asthma has put her in the hospital for 24 hours. due to
Sure.
that. Asthma is a huge concern to me. Is that something that I need to be worried about that could bring her possibly out of remission?
No, well, not so much that, but just for her comfort. In other words, have your bronchodilator there when you live in a city area in Utah.
Yeah.
Yeah, that when that happens, you're just going to have to keep your little bronchodilator available.
Okay.
To deal with those episodes to make yourself comfortable.
And then I've just from doing some research and talking to other kids who have the RSD, something bringing like a flare up out would be cold, a flu. How true is that? What do I need to watch out for?
Right. Even though she had a bad experience with the tetanus shot, in her arm, I would say the risk-benefit ratio favors her having a flu shot because these people who have CRPS or history of CRPS are just so miserable when they get the flu.
And just let anybody give her the flu shot? Or
No.
do I need to be careful about
Go
that?
someplace where they do a lot of them, where they can use a very fine needle and
What type of needle?
it's a fine needle, 25 gauge or less.
Okay.
Can do the job. Not very deep, just get the job done.
Okay.
But do go to a place where they do a lot of them because she doesn't need to go. You don't have to go very deep to get the job done with her. I did tell you though, however, most of us will be over the soreness in our arm maybe 2 or 3 days, but it may last for a week in her case. But she'd rather deal with a week with a sore arm than to deal with the flu, which can really be devastating. So.
To her condition as far as making her flare up. Now, if a flare up were to happen, does that mean she's out of remission, or does?
No, not at all. That's why I want you to keep track of her exercise tolerance. Remember we talked about measuring that, and also you got the video to measure against, for objectivity, and see what's going on there. Because she's not living in a bubble. We don't want her living in a bubble.
We don't.
She knows she's going to be careful not to avoid. She's going to try to avoid those activities where there's a high risk of injury, re-injury.
Right.
But things happen, You know what they say, SH, right?
Yeah.
Stuff
happens.
Stuff happens, right. Okay, so. How come you're turning red? Okay, so anyway, any other questions here?
Yeah, her double vision, she's had some double vision.
Yep.
That seems to be improving with goggles in
Sure.
the water.
Right.
And with some drops, like you mentioned,
Right.
over the phone.
Right,
She
right.
still has a little bit of that, but I think it's decreasing with time.
Sure.
The sleeping fatigue, she's so fatigued all the time. I found that I get her these gluten-free protein bars.
Yeah.
That's what pulls her out of bed finally at 12 o'clock, 1 o'clock, 2 o'clock in the afternoon.
Right.
So I've been giving her a lot of things protein related, but she has extreme fatigue. She's exhausted all the time. She's, anything that I need to watch for with that. Or
Well,
comment on that.
no. I think you get to give her some time. Listen, she's for almost 6 months. She's been totally incapacitated.
Right.
She needs to build herself back up. Her exercise tolerance needs to be improved upon. All that takes time. Unfortunately, when you're set back with the CRPS, it takes time to restore a lot of these functional things. Okay. So no, I expect that to all improve. The other thing, another question that came up, you asked earlier, what about if she, later in life, what about having babies and that sort of
Yes.
thing? As far as we know, patients, that's not a problem. As a matter of fact, most of the patients that have had ketamine or CRPS, their symptoms usually decrease during pregnancy, okay?
Okay.
So there's something about being pregnant that is nothing to worry about. There are some precautions that should be taken, but it's not something to really worry about.
Okay. And then just the popping of her joints.
Yeah, no, I'm not too worried about that, and I don't think you should either, except to suggest you get some earplugs, okay?
Yes.
All right.
It's like nails going down on a chalkboard. It's terrible.
Right.
The other thing is like the cold temperature out in Utah. Again,
Yeah.
we live where it's cold 6 to 8 months out of the year. We talked before about the colder weather bringing somebody out of remission. Could possibly bring somebody out of remission.
I don't worry too much about that. Just she doesn't want to get out into some damp, cold air and get all chilled out. She doesn't want to do that.
So, what type of? So when we're talking about colder weather, I mean, if she's indoors while it's cold, I mean, is she okay? Does she need to?
No, nothing
What do I need to
special.
watch
No,
out for?
nothing special with that. Just the usual creature comfort type stuff. I wouldn't worry too much about that.
Just make sure she doesn't get chilled and cold.
Yeah, cold and dampness can be hard because it kind of makes the muscles really irritable. It's true on everybody, and especially patients that have CRPS. So,
So going back and to the possibility of living in Utah, going back out to Utah, and another winter coming up next year.
yeah.
Is that something we would need to watch for on bringing somebody out of remission? Because again, I talked to you before about moms telling me where somebody during the colder months they would have a flare up and their kids would come out of remission.
Yeah,
So then
well, generally speaking, this is general, okay?
Okay.
Always exceptions. Patients with CRPS don't do well in cold climates. That's why we got a lot of them that are down here in Florida. We got a lot of them in Phoenix and places like that, okay?
Right.
Because they just generally don't do well. That doesn't mean you have to move, okay? It just means you have to be, a little bit more careful about letting yourself get all chilled out, okay? That's all.
Okay.
Okay?
And water temperatures like beaches and water parks.
Anything between 82 and 86 degrees Fahrenheit is good. Some people want it warmer than that, but that usually gives you an idea of what the water temperature that works best for people like you, okay? Just remember, when you first get in the water, everybody gets chilled for a few minutes, but then you get over it once you get moving around, right? Okay. Okay. All right.
She has a question for you.
What's that?
Will I be able to dance and do gymnastics competitively again?
What did I say? What did I tell you? Don't get involved right now in any high risk injury things, okay?
Yeah, but like
Later,
when-
once you build yourself back up again, then you can think about it, right? But not now. That's the most common reason, that by far, the most common reason why people have go out of remission is re-injury, by far. But once you build yourself, give yourself 6 months to build yourself back up again, then you can start thinking about taking some risk, okay? Got it? All right, okay.
Fair enough.